Hey everyone, we're about to do a dry needling technique for the pronator teres muscle. For us manual therapists, we know that this muscle gets a bit of a workout with all the soft tissue work we do. So dry needling for this particular muscle is going to be very useful for a lot of you. So before we do that, let's first of all identify if our client here has an issue with this muscle. And a really simple test that we can do is ask them to hold a pen. And we're going to do a comparison between supination and pronation. Holding the pen gives us just a bit more of a visual cue about the angle and range that this person has. So we'll do pronation for a start. So he turns it around in a pronation. We can see that we get to almost 90 degrees of pronation with the pen in the hand. We bring it back to neutral. Now he goes to supination. And he's obviously very stiff on that side. So this is going to be hopefully very useful for this forearm. All right. Okay. So before we insert the needle, we need to make sure that we swab the skin, clean it, ready for insertion. We're going to use a small needle. 30 or 40 mil needle is going to be fine for this one. And we need to identify that medial epicondyle. Coming off of that point there, we're going to have the two heads of the pronator teres as it comes down and extends across onto the radius to assist with, when it contracts, assist with pronation, assisting pronator quadratus at the other end of the forearm. So we find that medial epicondyle, come down about 2 centimeters below that to keep us away from that median nerve and ulnar nerve. The median nerve actually passes between the two heads of pronator teres. So if we want to put ourselves in that lower portion of the belly. From there, the needle's going to be inserted almost straight in towards the ulna, directing it towards the ulnar bone, angling down into that muscle. It can be quite thick and tender, so just go in cautiously, looking for feedback. And as we hit that muscle, it'll be quite thick. And you can even do a little wind on that needle to pick up some of the fascial component of that muscle. Great way to get a release in pronator teres.